Hello, potential students. Just trying to get things organized here. The goal of this video is so that I can maneuver through the different areas of the website to make things easier for you to apply to the program. So I'm going to get started. First of all, my name is Adele Harrell. I'm the interim program director for New Orleans CARE. It's an accelerated BSN program, and we are very excited that you're looking at our program. We have a wonderful NCLEX pass rate, and we have a very rigorous and strong program. So with that being said, I'm going to give you a little overview of LSU. So maneuver some things around here. If you see here, LSU is a health science center. What does that mean? So we are built in with allied health professionals, which are going to be your PT/OT, speech therapy, dentistry, graduate studies, medicine, nursing, and public health. And because we are a health science center, that means that we have a cadaver lab, which is very unique. There's very few nursing schools in the state, in the nation that has a cadaver lab. And it is very beneficial because it really does help you understand what the body looks like internally. All right, so I'm going to get started. So what do you need to know? You need to know mainly here is the nursing page and prospective student here. So if you come to prospective students, you're going to go to the academic programs. Let me go back real quick. There are going to be some informational sessions available to you for CARE. So you'll go underneath the CARE area here, and you will register for an informational session. I'll be offering them quite frequently throughout the rest of the summer, and then probably once a month once the fall semester hits. So we're going to go into academic programs, and we're going to go ahead and I'm going to show you where we're going to go. We have a New Orleans and a Shreveport campus. New Orleans admits once a year in the fall. Shreveport will be admitting their first class in the fall, and then they will be doing a fall spring admit. So when you come on and you're interested in the New Orleans campus, make sure that everything you select is for the New Orleans campus. So here I am here, just a little overview about our program. It's a very rigorous 20 months, 5-semester program. I'm going to show you how everything looks as I go through. So we're going to go and look through the admission criteria here. Excuse me. So there will be an application fee. Currently, you'll see that the all of this is in fall 2020, the nursing CAS. You're going to actually go to nursing CAS and apply if you decide this is the school of your choice. The application deadline is January 15th, and the application on nursing CAS will open up every August. So anyways, if you're going to go, we're going to go, you'll have to have a bachelor's degree in order to apply. That means you can pending a bachelor's degree. So a lot of times we get students that apply that will be graduating in May. So when the application, they will apply in a fall semester, looking to graduate in May. They're finishing up their prereqs, and their application is in by January. When the application deadline is closed, and then they graduate in May. So we do need the graduation degree and everything submitted prior to you starting. But this is a program only for students that have a bachelor's if they're looking to change their career trajectory. The main question that I get here is about the prerequisite courses. So you have to have 43 hours of prerequisite courses. In your biology lecture, your biology lab, your microbiology, and your physical science courses, you have to have a grade of B or better. So in the event, if you have a C, we cannot accept a C. So you will have to retake that. You can be pending courses when you apply. So all of the final grades on the official transcripts will have to be submitted by the deadline prior that student services will give you prior to you starting school. So if you have 12 outstanding prerequisite hours that you're finishing up, we will submit for a provisional admission, meaning that we have all of your information once school starts. Students that have everything, you don't have to worry about the provisional, but a lot of times students are trying to take one outstanding or two outstanding courses as they put their application in. So we don't want that to discourage you because we do take a lot of provisional admits. So if you look here, we do take up to 9 hours of the AP and CLEP coursework here. And if you'll go here to, I'm going to go, well, I guess I'll go to your GPA. Also for your GPA, you have to have a 3.0 or better. So if in the event we have a calculator, a prerequisite GPA calculator here, if you put in all of the grades that you think will transfer and you have below a 3.0 GPA, you might want to take a course to repeat it. We take the higher course grade. So if you got a C in microbiology, we wouldn't be able to accept that. If you got a C in psychology and you wanted to repeat it to get an A to increase your application GPA, you could. Let's see. So let me go ahead and I'm going to go to your prerequisite courses. So you need an English Comp 1, English Comp 2. You need to have a college algebra. If you've tested, a lot of students will test out of English Comp and algebra. But if in the event, if you go higher and you take trig and other algebras, college math after college algebra, a lot of times what I'll do is I won't give you credit, but I'll pull an A if in the event, if you have an A. Also, you need to have a statistics course. And because a lot of the students have degrees, there's different types of statistics. So if you're uncertain, all you have to do is email me and ask me. And then your biology and laboratory need to be a science major course. So it'll be a 3-hour biology and a 1-hour lab. You have to take a microbiology theory and a physical science, 3 hours. So let's talk about the physical science. Your outstanding physical science, and you need to take one. I highly recommend that you take chemistry because this chemistry will prepare you for nursing school. I tell students don't try to get out and take geology or something easier because we really want to prepare you for a rigorous program and we recommend chemistry. For your sociology courses, you'll need to take a 3-hour intro, an introduction to psychology, a developmental psychology, or it's called human and growth developmental psychology. And you need to have a fine art. The fine art includes music, visual arts, applied arts, theater, and dance. And then, of course, your humanities can be literature, foreign language, history, communications, philosophy, classical studies, and religious studies. When you're looking at transferring for colleges, everything has to be conformed to the Board of Regents requirements in order to graduate and apply to the curriculum. I give you a quick overview of what it looks like, your different blocks. However, I'm going to bring up a calendar that to show you really what it looks like. So your first block that you come in, you'll take all of your heavy science courses, and then you'll also take an introduction to professional nursing, but this health assessment theory and lab. This is where you learn how to assess a patient. Your health science center course, physiology, anatomy, pharmacology, and pathophysiology are taught by the health science center instructors. They have PhD in the category. So you have a PhD in physiology and anatomy that teach this. We have nursing faculty that teach the health assessment theory and lab. And then this is your first nursing course. Then you have your block 2, where you start with your fundamentals of nursing, your foundations of nursing. It has a theory, practicum, and simulation. You actually go into the hospital and you start with patient care here with a pharmacology and a pathophysiology. Once you finish, so then you'll go into adult health, mental health, research, and child health for your block 3. And then for your block 4, you'll have women's health, genetics, critical care, which is ICU, and populations health, which is community health. When you hit your block 5, you are officially a senior and getting ready for graduation. And so you're mainly you're working on your practicum, your nursing management practicum hours. You have 185 clinical hours that you need to complete before graduation. It's a one-on-one clinical experience, where in all of the other clinical courses, you actually have 10 students to 1 faculty ratio. So this is where you go on your own. So nursing CAS, this is where you will upload all of your information. You will upload all of your grades from your transcripts. You'll upload your transcripts. Everything will be verified through nursing CAS. We have an application fee, but also nursing CAS will charge a fee as well. This application opens up on August 15th. So in the event, if you are an international student, you will need to have your transcripts be evaluated by a credentialing evaluation service. And these are the two that we recommend here. And then also there is a transfer tiger table here that if you're from LSU, you can put information in and see if it transfers or not. A lot of times what the students do is they will send me their transcripts and I will do an unofficial transcript review and then give you some guidance. Endorsements is part of the application process. Once you have submitted all of your transcripts, you've got everything ready, you might be outstanding some courses, you're doing your application process, you will submit 2 endorsements. One will be an academic and one is a professional endorsement. And a lot of times the students will call me about academic endorsement. Some students are in school, some haven't been in school for a very long time. So if you're having difficulty getting an academic endorsement, we do not want you to not apply. Just send me an email and I'll give you approval for 2 professional endorsements. Then once your endorsements are uploaded, and your transcripts in, then it will come to the program director, and then I will go through everything and approve your transcripts, approve your endorsements. Once I approve everything, then you will hear from student services, and they will set up the next process. And so there's going to be an interview and a written statement. So you'll have a proctored essay, and then you have an online interview process. And this is part of the application. The faculty will grade and score the interview and the written statement. And so between your GPA, your endorsements, your interview, your written statement, you get scores for each component of the application status. All right, we talked about having a GPA of 3.0. Let's see, interview process. We've done all of that. So bear with me. We have more application information here, the admission criteria. I highly recommend that you do this tutorial prior to going on to nursing CAS. I tell students upload everything that you have from all the different schools and all of your grades, because I always like to pull the higher grade. Right. So I showed you the GPA calculator so that you have that. We have all of this information here, certification and license here. So this is for your BSN. You will, at the very end, after you will graduate, and then you will take the state board, which is the NCLEX. And that is, you need an NCLEX RN examination. You need to pass this in order to practice. So I tell people when you're looking at programs, you want to know about the NCLEX pass rate. It's very important. If they have a low NCLEX pass rate, you definitely want to make sure to look at other programs. We are combined on the website. We're combined with care and the traditional program. We're combined, but typically our care students, we have 100% pass rate. I can't remember when the last time somebody from care has been unsuccessful. So let's see, we talked about graduation requirements here. So you'll have 120 semester hours completed. You'll have fulfilled 60 semester hours of work. When you get into the 4,000 level, you know you're in your senior course. And then also, like I said, you have to maintain a GPA of 2.0 or better. All right, so what I'm going to do real quick is I'm going to go into what a schedule looks like for the students. This is the incoming class. And this is what their semester looked like. So you will start and end on a more normal academic pace. And the reason for that is that you have heavy course content. So you'll be admitted in the fall semester. And then you will take 5 semesters back to back and graduate in May. So I'll review that with you. So this is our incoming class. They'll be admitted in the fall of 2023. They'll be taking a physiology, anatomy with the cadaver lab. You'll have an intro to a professional nursing course and your health assessment theory and lab. This is where you learn how to assess a patient. From there, the turnarounds, because we are an accelerated program, there's very little break time in between. You do not follow along the normal academic calendar breaks. You break when faculty breaks. This is why I put your holiday breaks up here. So then you go right into block 2. See, there's a very quick turnaround here. Then you have your foundations of nursing course. This is when you actually go into the hospital for the first time. And then you have your patho and your pharmacology. This is a little bit faster pace. Not as slow as your first block, but it does tend to speed up. And we do have Mardi Gras holiday here. And if you see here where normally traditional classes will resume 2 weeks into January, you guys will resume immediately when the faculty does. So you will have theory foundations is spread out over Christmas holidays as well. You will finish before patho and farm, and then when you're done here, you move to your block 3. There is no spring break. You take off for Good Friday with the faculty, and you get a 3-day weekend. Then you'll go into your mental health rotation, and you have nursing research, which will overlap at the same time. You'll finish up research and then finish up mental health. Then you go into your adult health, which is building block for your foundations course. And you will be in the hospital doing clinical practicum and theory for the summer. When you're done with that, you have a very quick turnaround and you go right into child health. And then you finish this at the end of the summer. This is truly an accelerated block. This is what your block 3 and your block 4 look like. By the time you get into block 5 and you slow down the academic speed, you're trying to catch your breath because it is a whirlwind through these blocks. I tell people, do not make plans during this time frame. We have very limited time for your courses. They're plotted out in 6 and 7, maybe 8-week time frame, and that's it. You're moving on to the next course. But it's concentrated. Once you do the research mental health, then it's concentrated and you have your adult health, then you go into child health, then you go into your block 4. Genetic goes through the normal academic pace, and then you have women's health. You'll start. When you're done, you'll go right into populations, and when you're done, you do critical care over the Christmas break. You will probably be studying for an exam, which is very unfortunate, and then you come back. You will, the first 2 weeks in January, you'll have critical care. You'll finish critical care up, and then you'll start your block 5. With the traditional students, you're in with traditional students in block 1 and block 5. So now you're back at your normal academic pace because this, once again, is a very heavy course load. And you are doing 185 one-on-one clinical hours. So we need to make sure that every student gets through, does all their clinical hours, and is successful by May, and then you'll graduate in May. So this is what a normal care block looks like. This is the main thing students want to know is what does it look like? So this is what I like to show you. So if you have any questions, any concerns, if you'd like for me to evaluate your transcript or your unofficial transcript, you can send it over. I will do an unofficial transcript review. I'm going to also offer some informational sessions. So if I've reviewed your transcript and you want to talk about it, you can meet me on an informational session. I will, talk to you via phone, so I'm easily accessible, and I'm pretty quick with returning emails. But we are so excited that you're looking at wanting to become an LSU Tiger. We hope that you choose our school. Like I said, we have a very high pass rate. We have a great reputation. And in the event, just so that you know, we do have a traditional program, which is beneficial because in the event, if there's a major life event and you have to slow your program down, we do not do a part-time program. We only do a full-time program at the very fast pace. So you would then, I would petition for you to transfer to the traditional program, and you could slow things down if you needed to. Hopefully all will go well and you can finish with your classmates, but sometimes, like I tell students, your journey, your nursing journey is your own nursing journey. Nursing is a wonderful profession. There are very many avenues of nursing. Let me show you all the different programs that we have. Let's see if I can get back into, the web. That now. Calendar. I'm going to go back in real quick and show you. Get into this. I do want to show you all the different programs that we have. I want to talk about your financial aid. Oh, that was what I want to talk about, was your finances. But if you look here and you want to plan ahead, here are all the different programs that we have, the graduate level. You have all the information from financial aid here. There are some local hospitals that are offering scholarships. The tuition and fees, I'm going to show you this real quick, only because I want to explain to you how it works. You're going to have all of these fees associated with the program. And then I'm going to show you exactly what it looks like. So when you're trying to calculate how much it costs, if you see here, I went to nursing, tuition and fees, and then I went to, let me go back for you. Prospective students, tuition and fees. They're going to go up here where it shows you the LSU EDU tuition. Go to the School of Nursing, and then scroll down to care. So if you see here, we have 5 semesters in care. So you would need to calculate 5 semesters. This is only going to show you 3 semesters. So you would do a fall semester, a spring semester, a summer semester, another fall semester, a spring semester, and graduate. So you'd have to calculate 5 semesters: fall, spring, summer, fall, spring. We are reasonable compared to we have a lot of students from California, we have a lot of students from New York, because our non-resident fees are actually cheaper than their resident fees. So we have a lot of students from out of town. We do have orientation here. We do have orientation for students in July. It's usually the 3rd week in July, sometimes the 2nd week in July. It is mandatory, and it is an on-campus, no remote option orientation. It's very important that you make the time to come in. This is when our students come in from out of state, and they actually look for apartment and housing. We do have student housing. It is on the website. You can find it. Just so that you know, as far as security, we are located in a big major city in New Orleans. There's a lot of activity year-round here. We have festivals, we have carnival, we have all kinds of events happening here. Because we are located in the city, our walkways from building to building are secure, and you are on an elevated walkway. You need an ID to actually get into the school. I tell students it's unsafe everywhere, all over around the world, especially in this nation. And so you just have to be mindful of your environment. But we have security all over. We have all kind of policies and procedures in place for students as well. So New Orleans is a wonderful city. Like I said, if in the event you are considering spring admit, I would recommend that you go and you look at the Shreveport campus. Dr. Leday is over the Shreveport campus and she can guide you because they do a fall and a spring admit. New Orleans is only a fall admit. Currently, the Shreveport campus has smaller classes. Our classes can range anywhere from 50 to 70 students. So anyways, let me know if you need anything. I can be easily found on the webpage. When you go to the prospective student, here, you can find me under academic programs here, and you can email me directly. So we hope you choose LSU. Please be in touch if you have anything. I'm available to you. Thank you.